If you have knee arthritis, you might be thinking about having a knee replacement and are wondering whether or not you're ready for surgery. Hi guys, it's Dr. Adam here. I'm an orthopedic surgeon. One of the most common questions I get asked is, Doc, do I need a knee replacement? And it's a really difficult question to give a yes or no answer to because a lot of it depends upon people's symptoms, which are difficult to quantify. However, one thing I find really helpful is to look at it the other way around and say in which situations is it a bad idea to have a knee replacement, or at least where you should have caution before going ahead with it. So in this video, I wanted to go through some scenarios where you just need to think carefully whether or not a knee replacement is the right decision for you. This video is for information purposes only, and you shouldn't base the decision around whether to have a knee replacement on this video. That has to be taken with your surgeon after speaking to them directly, but the aim is to give you some useful background info so that when you do speak to your surgeon, you're better informed. When we talk about knee osteoarthritis, it's a spectrum from early wear and tear through to bone-on-bone arthritis, where the bones are literally grinding against each other because there's no cartilage left. Now this might surprise you, but we don't actually understand the mechanism fully by which arthritis causes pain. But one thing we do know is that when it comes to knee replacement surgery, if you have bone-on-bone arthritis, you're more likely to get a predictable outcome in terms of pain relief than people who don't have bone-on-bone arthritis. Now, this could be because bone-on-bone arthritis implies the symptoms are worse, or it could be something to do with the fact that when you have no cartilage left, the bone and soft tissues then react better to having a knee replacement put in, and we don't fully understand how that occurs. But whatever the reason, if you don't have bone-on-bone arthritis, it's just a bit of a red flag and you need to be cautious before going ahead with knee replacement. Your surgeon will get weight-bearing x-rays, and this can make a big difference. So if you look at people who have x-rays when they're lying down, for example, those often taken in the emergency department after an injury to the knee, versus the same person who has an x-ray when they're standing up and weight-bearing, often the joint space can seem much narrower on the weight-bearing x-rays, and your surgeon may also want to get other views, for example a Rosenberg view, which is a flexed weight-bearing view, or actually an MRI scan to look at the cartilage in more detail. But whichever form of imaging they get, they'll be looking to see how much cartilage you have left. So at this point you might be thinking, okay, I've got pain in my knee, I've tried all the non-operative treatments like physiotherapy, weight loss, injections, and the pain is still there. So surely the next step is to have a knee replacement, and that's likely to help. Well, this isn't always the case. Sometimes you can have what we call referred pain, where you have back pain or hip pain that presents as a pain in the knee. So I've seen quite a few people over the years who present with severe knee pain, and it's a bit of a dilemma because you get the x-ray and it doesn't seem as if the arthritis is that bad. They're moving their knee, but then when you examine the hip, it's incredibly stiff and painful. And when you get an x-ray of the hip, lo and behold, they have severe hip arthritis, and the hip replacement actually makes their knee pain go away. And a similar situation, although less common, can occur with back pain as well. So you just need to be careful and make sure that the knee pain is actually coming from the knee joint itself. If there's any doubt about this, your surgeon may want to inject the hip or the knee to try and work out the relative contribution of each towards your symptoms. Now, traditionally, if people have severe hip arthritis and severe knee arthritis, then we tend to deal with the hip first, partly because some of the knee pain can resolve once the hip is dealt with, but also because if you have hip arthritis, which is limiting the flexion or bend in your hip, it's very difficult then to actually bend the knee, because to bend the knee up, by definition, usually requires some bend in the hip. So your function of the knee replacement may be compromised if you don't deal with the hip first. Another cause of knee pain, which is not related to arthritis, is the soft tissue structures around the knee, tendons, ligaments, nerves, all of which can cause pain, which can mimic pain from knee arthritis. The meniscus is a particular cause of pain, and I've actually made a separate video on this as there's quite a bit to talk about, so please do check that out. So if there's doubt about the knee joint being the source of the pain or the arthritis within the knee causing pain, as opposed to other structures, you need to be careful before going ahead with knee replacement, and you also ideally want to make sure that you have bone-on-bone arthritis in the knee. It's also important to make sure you've tried all the different non-operative treatment modalities available, and I've seen plenty of people who come back having lost weight or taken up cycling or walking that find that their knee arthritis pain gets better to the point where they no longer wish to have knee replacement surgery. You've decided now that you want to go ahead with surgery, and you're trying to make the decision whether or not now is the right time. One thing I would say is it's worth taking time to optimize the risk factors around surgery. So, for example, if you're diabetic, get your HbA1c and blood sugars under control. If you smoke, stop smoking. All of these things affect the risk of, for example, infection and other complications following surgery. And because it's an elective procedure, it's worth taking some time to try and optimize your conditions before going ahead with surgery. So this is not to try and put you off knee replacement surgery if you need it. And I spend lots of time treating people with arthritis who are very happy with knee replacements. But it's worth remembering that if you look at everyone who has a knee replacement, there's around 20% of people who are dissatisfied in some way with the knee replacement, which is actually quite high, and most people don't realise that. The exact mechanisms why that's the case aren't fully understood, but 1 in 5 people are not fully happy. So you need to be sure, firstly, that you've tried everything else, and secondly, that you are doing it with the correct indications, which your surgeon will check with you before going ahead with the operation. I hope you found that video helpful. I've got loads more content on my channel about preparing for knee replacement, how to reduce your risk of infection, and what to expect following surgery. So if you did find it helpful, please do hit subscribe and like, and also share with your friends and family who may find it useful too. Thanks.